can you give us an update on the new outbreak that's in the city?
So we do have an outbreak that's been declared at a daycare setting in the West End called Tiny Hopper. They have come forward and communicated the outbreak. I just want to say thanks to everyone that's come forward and gotten tested. We can't do our work and find these outbreaks unless people get tested. So thank you very much to the families that came forward. The first test we received on March 1st at around 5:30 in the evening, it was a test of a positive child. There was no history of travel or any occupational risk or other contact risk in the family, in the parents. So we were very concerned of how that child acquired the infection. They had been at a daycare, but it was over 2 days before. So traditionally we wouldn't even have included, but given our concerns, we then at 18:40 on that same day, given that we couldn't find any means by which the child acquired the infection except at the daycare, asked that everyone at that daycare, so all 56 children, all staff, other children and family members get tested. And this is our approach to try to find the source of infection for this one positive case. And when we had further positives that were associated with this daycare setting, we did declare an outbreak. It was publicly declared March 3rd, so the time difference is it takes 48 hours to get the results back in our hands. But I want the public to know, within an hour of our receiving it, there was decreased risk to the public because all of these families were in quarantine and getting tested. Our first test back on VOC, variants of concern, VOCs, has been negative, so that's some reassurance. We're waiting for the testing on all the other samples, but to date we have 7 positive staff and 2 children, and these are in the toddler section of the daycare. I have to thank, we've had over 178 people that came forward and gotten tested as of yesterday. I know it's difficult to take the time out to get tested, but it's so essential to help us do our work. Thank you for those that have continued to quarantine. Now that we have the variants of concern test back, we'll be sending communications to families about what our expectation is for further testing and to get out of the quarantine phase. So clearly outbreaks can happen very quickly. In our experience in workplace settings, clearly the exposure to children has been quite minimal, and that's good news because all the workers are adhering to the best practices. But sometimes there's gaps at lunch or during breaks and or when you commute together to a workplace. So please reassess in any workplace, the distancing within the lunchrooms, also separating if you're going outside during a break, and maintaining your mask and hand hygiene at all times. As well, please screen yourselves before you go to any workplace for any signs or symptoms of COVID, and if you have them, get tested. If your symptoms persist despite a negative test, please call your healthcare provider. They may advise you to get retested. In one instance, the first test of a worker was negative, the second test was positive 2 days later. So there's no other viruses circulating right now. If you've got viral symptoms, the high probability that it's COVID. So first test negative, consider getting retested after consultation with your primary care provider.